Hello students, I am teacher Svetlana and in our today's lecture we will learn about the nutritional disorders and the disorders of the digestive system which is covered in the chapter Human Nutrition. So let's begin. Students, nutrition related disorders can be categorized based on the food that an individual consumes and the condition that develop due to malfunctioning of the organs or glands associated with the digestive system. You are already aware that little or extra nutrition can lead to dietary disorders. Inadequate intake of proteins causes protein energy malnutrition, which is called as PEM. It can be associated with inadequacy of vitamins and minerals in the diet. PEM can cause diseases like kwashiorkor and marasmus. So let's have a look at what is kwashiorkor. This protein deficiency disorder is found generally in children between 1 to 3 years of age. Children suffering from kwashiorkor are underweight and show stunted growth, poor brain development, loss of appetite, anemia, protruding belly. Here the image kinds of highlights these symptoms: slender legs, bulging eye, edema of the lower legs and the face, that is swelling in the lower legs and the face, change in skin color and hair color. So this is a type of malnutrition which is commonly believed in part to be caused by insufficient protein consumptions, and also there could be likely deficiency of micronutrients like iron, folic acid, iodine, vitamin C and certain antioxidants. The next one is marasmus. It is a prolonged protein energy malnutrition PEM found in infants under 1 year of age. In this disease, protein deficiency is coupled with low total food calorific value. Inadequate diet impairs physical growth and retards the mental development. Subcutaneous fat disappears, ribs become prominent, limbs become thin, skin becomes dry, thin and wrinkled, loss of weight, digestion and absorption of food stops due to atrophy of the digestive glands. There is no edema, that is, there is no swelling found in the patient. Major cause of this disorder is unavailability of nutritious food. Have a look at this image here. This child here highlights these symptoms. Poverty. Now, the major causes include poverty, large family size, ill spacing of children, early termination of breastfeeding, and over-diluted milk are a few of these causes. Because of malnutrition, infectious diseases become opportunistic and it worsens the condition. Proper diet can help in reversal of the symptoms. Now, children with marasmus normally have body mass that is reduced to less than 80% of the normal mass for that height. So it leads to extensive tissue and muscle wasting and edema, that is accumulation of fluids beneath the skin. Here in this case, you'll also find the patient often very irritable and very hungry, unlike in case of kwashiorkor where the patient suffers from loss of appetite. Indigestion. Overeating, inadequate enzyme secretion, spicy food, anxiety can cause discomfort and various symptoms. It is called as indigestion. Improperly digested food or food poisoning also can cause indigestion. It leads to loss of appetite, acidity, that is acid reflux, heartburns, regurgitations, dyspepsia, that is upper abdominal pain, stomach pain. So to avoid this situation of indigestion, we have to avoid eating large meals, lying down after meals, spicy, oily, junk food, smoking, alcohol, and these are some of the preventive measures for your indigestion. Constipation, this is one of the frequently encountered disorder of your digestive system. When frequency of defecation is reduced to less than once per week, the condition is called constipation. Difficulty in defecation may result in abdominal pain, distortion, rarely perforations. The causes are affected chronic mobility due to Neurological dysfunctions like spinal cord injury, low fiber diet, inadequate fluid intake, and inactivity. Roughage, sufficient fluid in the diet, exercise can improve the condition. Here you have an image of a normal bowel, and here is a constipated bowel where you have stagnation of the fecal mass and hardening of the fecal material because of insufficient fluid intake. Diarrhea, passing loose watery stools more than 3 times a day is called as diarrhea. Diarrhea can lead to dehydration, that is loss of fluids or water from the body. The other symptoms are blood and stool, nausea, that is you feel like vomiting, bloating, heaviness in your stomach, fever, depending on the cause and severity of the disorder. The causes of diarrhea are infection through food and water, or disorders like ulcers, colitis, inflammation of the intestine, or irritable bowel syndrome. So here the symptoms are pictured for you. The next one is jaundice. We all associate jaundice with yellowness of the conjunctiva of the eye and skin and whitish stool. These are the symptoms of a condition called as jaundice. It is a sign of abnormal bilirubin metabolism and excretion. Jaundice develops if excessive breakdown of red blood cells takes place along with increased bilirubin level that the liver can handle, or there is obstruction in the flow of bile from the livers to the duodenum. Bilirubin produced from breakdown of hemoglobin is either water soluble or fat soluble. Fat soluble bilirubin is toxic to the brain cells, hence serum bilirubin value has great diagnostic importance. There is no specific treatment to jaundice. Supportive care and proper rest are the treatments given to the patients. Have a look at this image here. The common causes are listed for you along with the symptoms that you can see in a patient suffering from jaundice. Vomiting. In this condition, the stomach content are thrown out of the mouth due to reverse peristaltic movement of the gastric wall. It is controlled by non-vital vomiting center of the medulla in your brain. It is typically associated with nauseatic feeling. With this, we complete all the nutritional disorders and the disorders of the digestive system that are covered in this chapter. Thank you, students, for participating in this lecture. See you soon again with the next topic. Till then, take care, be safe, and keep learning.